Hey Dad, you know what will be a great New Year resolution? You could try to get in better shape. You could start eating more vegetables for your kidneys. A 61-year-old dad decided to improve their health. He started following a better diet full of veggies he was never eating before, such as spinach, potatoes, beets, rhubarb, and more. This is what happened to his kidneys. CM is a 61-year-old businessman and father of 3, presenting to the emergency department of the Health Adventist Medical Center in Bolingbrook, Chicago, with severe shortness of breath and weakness. He is on a wheelchair because he can't support his own weight anymore, and he is gasping for air. They will later find out that his creatinine was very high at 15.11 milligrams per dl, meaning that he was suffering from acute kidney injury and he was in need of emergency dialysis. His son explains to the admitting nurse that just a few weeks earlier, he convinced his father to start eating vegetables. Is this all my fault? The son asked the nurse, but the nurse shrugged off that hypothesis. Vegetables don't cause kidney damage. Or do they?
Wait. What?
Gathering here, welcome today to a new real story from the emergency room. As usual, this patient story is based on a real case report which was published in the World Journal of Nephrology and Urology in March 2020. But today's case is special to me, and well, today's case also comes with a warning. Things are not always what they look like in a medical mystery like this one. What caused a CM problem is still being studied today by medical science. This is a type of kidney damage that doesn't happen very often, just in about 12 patients in the last decades. And if you think this is interesting, remember to share this video so other people can enjoy it too. But don't get to a conclusion about what happened to CM before seeing how it actually ends. Because you see, before being hospitalized, CM was suffering from diabetes and gout, but his kidneys were okay. He was taking metformin for his diabetes, statins for his cholesterol, and allopurinol for gout. But CM never really paid any attention to his own health. His job and his family always took priority in his life. Nothing else really mattered, his own health included. He would very frequently binge on peanut butter by eating up to half a jar in a single sitting. And he was also used to drink 3-4 large cups of coffee daily. But this year, it was going to be different. CM promised to his younger son. And he took his New Year resolution pretty seriously. A promise to his own son wasn't something he was going to forget, and he decided to start immediately getting better by adding more vegetables to his diet. But that's when things started to go south for him. After 1 month of his new improved diet, his legs started to swell. He never suffered from swelling before, but he didn't really have the time to pay attention to that symptom. He had too much work to do that week. After 2 months of his vegetable-rich diet, he woke up one morning so tired he was barely able to get up from his bed. He had to call in sick at work for the first time in years. Even his secretary was dumbfounded and worried. CM was never sick and he was always working. He eventually did get up from his bed just to go to the bathroom. What happened next really scared him. There was something red in his urine. And he also noticed for the first time that he was breathing way faster than what he was used to. What is happening to me? He thought. Should I be booking an appointment with my doctor? Or are you supposed to call an ambulance if you see red in your urine? But there was no more time now. Going back to bed, CM's head started to spin so fast he lost his balance and fell to the ground. He was barely able to reach his phone and to call for an ambulance. When CM was brought to the emergency department, he was found to have suffered severe acute kidney injury. His kidneys were not working anymore, and that was causing all the symptoms: swelling, fatigue, hematuria, even his inability to breathe and to sustain his own weight. Something was destroying his kidneys, And it was not diabetes because, well, it was way too fast to be diabetes. You see, before being hospitalized, serum creatinine was just 1.6 milligrams per dl, just slightly high, not even high enough to be considered kidney disease. His diabetes was being treated, and he had no family history of renal disease, kidney stones, or any gastrointestinal disorders. His creatinine was now 15.11, however, and his GFR was down to 2.8. His kidneys weren't working anymore. But why? What was causing all that damage to his kidneys? After the first dialysis session, CM was lucid enough to help the doctors finding a diagnosis. He confirmed that he was still taking his diabetes medications, and he also denied any consumption of dangerous substances. He wasn't even taking NSAIDs or antibiotics known to cause damage. He told the doctors he was never exposed to anything dangerous for his kidneys, like contrast media in an MRI. Nothing made sense, and the doctors were confused. But you know, CM kidneys weren't being destroyed by an alien force or an ancient curse. There must have been a medical explanation for what was happening. Maybe a renal ultrasound was going to give the doctors the answer they needed? It was the third day of CM hospitalization now, and the renal ultrasound was completely unremarkable. Just one more thing to do now, a renal biopsy. A renal biopsy is a medical procedure in which a small piece of kidney is removed from the body for examination, usually under a microscope. It's a way to actually see what's going on in the kidneys. This time, what the doctors found out in CM kidneys was so remarkable. They actually wrote and published an article about this finding. Now, what are we looking at? Here you can see fibrosis in CM's nephrons. Fibrosis is a term that indicates that the tissue in the nephrons, the tiny filtering units in the kidneys, is being damaged. Fibrosis means thickening or scarring of the tissue, and here's the cause of the damage. These bright spots you see here are calcium oxalate crystals in CM's renal tubules. Now, calcium oxalate crystals are the most common cause of kidney stones. These are hard clumps of materials that are tearing through CM's nephrons and tubules, destroying his kidney function. Now, this brings us to an even bigger medical mystery. How is it possible that a man with no history of kidney stones nor risk factors completely lost his kidney function at 61 years old? Due to oxalate crystals? There are various known mechanisms that can cause oxalate crystals to form, a surgery or a disease that cause increased absorption of oxalate, but CM didn't have any disease or surgery that would cause oxalate problems. A very high intake of vitamin C, like what happened in one of the case studies we have already seen up here, is also a cause, but CM wasn't supplementing any vitamin C. A dietary deficiency of calcium, magnesium, or water intake may also cause oxalate crystals. So now CM is being questioned about his diet. He said he was always drinking lots of water, but admitted to a diet that was consistently heavy in nuts and coffee and in many vegetables rich in oxalates such as rhubarb and beets and spinach and all that good stuff. But he also claimed to consume enough calcium by eating cheese and yogurt almost every day. So having oxalate crystals shouldn't have been possible for him. And yet, here we are. And you see, a case of kidney damage caused by oxalate crystals in absence of any of these risk factors is incredibly rare. It only happened around a dozen times in medical literature. And it's, well, worth publishing a paper about it. Almost time to see if CM was eventually able to make it home safe or if he was going to have to do dialysis for the rest of his life. Before that, a very important question I'm sure many of you guys are thinking about now. Are oxalate-rich foods dangerous for those with chronic kidney disease? Foods known to be highest in oxalate include spinach, rhubarb, beets, legumes, nuts, chocolate, and coffee. And these are all very healthy for you, coffee and chocolate included. And while it's not recommended to consume coffee and peanut butter in the amounts CM was consuming, they could be part of a healthy diet. But CM's diet was what caused his kidney to fail in a very short amount of time. Can that happen to other people too? Well, that's unlikely for most people, kidney patients included. You see, bacteria in your gut will break down oxalates before they can cause you trouble. Dietary calcium is also going to prevent oxalate from crystallizing in the kidneys. And while many calcium-rich foods are to be avoided in a renal diet, taking Tums and antacids that are made of calcium carbonate is both a way to keep phosphorus levels down and to prevent any risk correlated to oxalate. Now, there are people that must pay attention to oxalate-rich foods, however, those prone to kidney stones. If you had kidney stones in the past, you are more likely to get them again. And if they are calcium oxalate stones, the most common type, limiting oxalate, will be a good strategy. People who have had gastric bypass surgery or surgeries that affect how the gut works may also have high oxalate levels in their urine. So if you have gut dysfunction or take antibiotics, you may want to eat a low oxalate diet. Now also those that have to limit their water intake due to kidney disease may be recommended to follow a low oxalate diet. But for most people, the benefits of nutrient-dense, high oxalate foods far outweigh their risks. And well, CM didn't have any of these risk factors for kidney stones as we have seen. So how is it possible that he had oxalate crystals in his kidneys? Researchers were only able to find one explanation for this incredibly rare phenomenon, a rare genetic mutation involving creatine protein which could have caused inflammatory problems. I'm not getting too much in depth about this, but it was actually only observed in mice before CM's case. CM problem was also linked to gout, so this paper also tells us that there may be a link between gout and kidney damage caused by oxalate. Okay guys, do you want to see how it ends? Let's see if CM was eventually able to make it home safe. After his hospitalization, CM was started on dialysis. After 3 weeks on dialysis in the hospital, CM gained back a little bit of kidney function. Unfortunately, when he left the hospital, his kidney function was still too low for him to be dialysis free, but not all hope was lost. You see, CM never had chronic kidney disease, and by completely stopping what was causing damage to his kidneys, there is hope for him to get enough kidney function back. CM was also instructed about his rare condition and told to avoid oxalate-rich foods. Now guys, I'm glad I talked about oxalate and the risk connected to what some call an anti-nutrient, because as we have seen, some kidney patients should actually limit their intake of this substance. Let me know if you want to know more about how to avoid the risks connected to oxalate in a future video. And in case you wanted to see more real medical mysteries like this one, this video up here may be interesting. A 63-year-old retired firefighter with no history of CKD is hospitalized for abdominal pain and immediately discharged home with a prescription of antibiotics and an OTC pain medication. It took just 1 week for these prescriptions to damage his kidneys so severely. He barely made it to the emergency room alive. This is his story. GD is a retired firefighter, 63-year-old, being admitted to the cardiothoracic surgery department at the University Medical Center with heart failure. Blood analysis shows acute renal failure complicated by metabolic acidosis, which is very strange because just 1 week ago, GD was pretty healthy for his age and for a retired firefighter. The day before Thanksgiving, GD took his morning prescription. A life spent as a firefighter exerted a toll on his joints, and his arthritis was acting up again like every autumn. But even if his heart wasn't that of a young boy anymore, like his doctor kept reminding him, GD wasn't worried. He was taking his diuretics and his blood pressure pills, and he was avoiding eating too much pizza and too much salt. What was making GD feeling down was the passing away of his dog just a few weeks earlier. His daughter tried to convince him to get a new puppy, but GD felt that he was just not ready yet. The holiday season, however, was coming and Gidi really believed that spending some time with his daughter and his family would have made him feel a lot better. That truly was his best time of the year, with his family finally reunited and his grandchildren running all over his home. This year, unfortunately, that wasn't going to happen. Gathering here, I've been working with kidney disease patients for almost 10 years now, and today's case comes with a most important lesson. This case was recorded in 2014 on the 31st of December and was published on a peer-reviewed medical journal later in 2015. This case is about one of the most common medical errors of our days. You see, today, most patients age 60 or more have to deal with a huge number of pills every day. Researchers found out that the average older adult takes 5 or more different prescriptions each day. But the prescriptions may be many more than that, like in the case of Gidi. He had a history of hypertension, being treated with a strong diuretic, an ACE inhibitor, and a beta blocker, and arthritis, being treated with aspirin. He recently developed a painful case of prostatitis that the doctor who visited him at the hospital was treating with antibiotics and some more OTC pain-relieving medications. And yes, that's a lot of pills, and for those of you that follow me here regularly, that combination may already raise a red flag. The primary care doctor wasn't particularly concerned, however, because Gidi kidneys were really doing well at his last checkup. He had an unviable creatinine level of 0.8, very good for a man at his age and with a history of heart problems. And while his doctor was more concerned with Gidi lungs due to his occupation as a firefighter, it was his kidneys that were at huge risk now. Gidi came back home after his hospital visit, and in just a few hours after taking his antibiotic and stronger OTC pain-relieving medication, he started to feel a lot better. Just in time to set up the decorations around his home, he thought, and to wrap the last gifts for his beloved grandchildren. But something was starting to go very wrong with his kidneys and his heart as he took those extra pills the hospital doctors prescribed him. 2 days after starting the treatment with antibiotics, Gidi started to see a foam on top of his urine every time he went to the bathroom. But he didn't really pay attention to that. He had too much to do around home. On the 3rd day after starting the treatment, Gidi's legs started to swell. He thought that his arthritis was doing that because his fingers were always swollen already, especially during the cold season. On the 4th day, he woke up so tired he was barely able to move from his bed. Am I getting the flu again, he thought, or are those antibiotics I'm taking? But it didn't matter because the hospital doctor was very clear that he had to complete the whole treatment if he didn't want to risk the bacteria from his prostate to reach his kidneys. On the 5th day, Gidi wasn't able to eat breakfast at all. Everything tasted like metal and it was so nauseating. On the 6th day, he was barely able to recognize himself in the mirror as his face swollen up like an inflated balloon. On the 7th day, his daughter finally came to visit and he found her father in a condition so dire she immediately called an ambulance. Gidi was brought to the emergency room, but the doctors found out reading his blood tests shocked them. When Gidi tests came back, the doctors first thought about a problem with his lungs, probably caused by his job. The heart of a firefighter is always under great pressure. Work near hot fires, exposure to carbon monoxide, and other stresses associated with the job was for sure part of the reason why Gidi's heart was now failing. So the doctors initially believed that was caused by the heart problem. But when they started looking at Gidi's medical history, things didn't add up. The heart problem alone wasn't enough to explain why a man without any previous history of kidney disease was now showing a creatinine level of 6.5 milligrams per dl. Creatinine level is one of the main indicators of kidney function, and in Gidi it was almost 6 times higher than normal. which means that GD kidneys failed completely in just 7 days, and he had to immediately started on emergency dialysis. But that was just a way to gain some time. They had to find a cause for the kidney damage and to stop it to save GD's life. Now the question is, if the heart problem isn't the cause, what could have been causing acute kidney injury in a man without any previous history of CKD? Acute kidney injury, or AKI, is a life-threatening condition characterized by an abrupt deterioration in kidney function. His doctors used the time provided them by the emergency dialysis to rule out all the possible causes of AKI. So, what can cause kidney damage so rapidly? Lack of blood flow to the kidneys was briefly evaluated and then discharged. There were no blockages in the urinary tract and the patient was still making urine. The tox screen came out negative for the most common substances. There was only one more thing to rule out: a kidney infection. And GD was having a prostatitis. He was even hospitalized in the same hospital as he is right now, just 10 days ago. And a prostatitis can be dangerous for the kidneys too, like GD doctor repeated him. Both the kidneys and the prostate are part of the urinary tract, and bacteria can spread from one organ to the other if the infection is left untreated. But that wasn't the case of GD either. As the doctors found out, he was being treated for his prostatitis with a course of antibiotics and an OTC pain-relieving medication. This is when, however, the doctor failed to recognize the medical error that was causing the kidney damage. So, what caused GD kidneys to fail? Today, there is one more commonly recognized cause of kidney damage that the doctors failed to notice. This is called the triple whammy, and it's very insidious. It's actually due to cases similar to that of GD if today the simultaneous use of diuretics, blood pressure medications, and NSAIDs has been associated with acute kidney injury. We know now that each of these medications, even if taken singularly, may decrease kidney function over time. Popular diuretics include hydrochlorothiazide, furosemide, which GD was taking, and spironolactone. They are associated with the risk for acute kidney injury. Same for both ACE inhibitors and ARBs, the most commonly prescribed medications to lower blood pressure. And while they protect the heart, no doubt about that, recent studies are linking their use to a faster decline in kidney function. Mixing these two, a double whammy, is a decision that some doctors have to take for their patients when they believe that saving the heart is more important than preserving kidney function. And it wasn't a wrong call in GD case, since his heart was in bad shape but his kidneys were doing fine up until 10 days ago. But we must understand that the combined effect on the kidneys is dangerous, especially like in the case of GD when these two are combined with an NSAID. NSAIDs include ibuprofen, ketoprofen, which GD was taking, but also paracetamol, aspirin, and more. It's extremely dangerous, and it's what caused GD kidneys to fail in just 1 week. But GD's doctors didn't know about the triple whammy back in 2014. Case reports like that of GD were made and are still being made today in 2022 to tell doctors to always perform an accurate pharmacological analysis before the prescription of a new medicine, so the patient doesn't have to be rushed to the ER. Research also found out that inappropriate prescription is incredibly common in the elderly, with a frightening prevalence of 40% to 50% among nursing home residents. So that's the lesson here. Get informed about anything you take, talk to your doctor, and ask questions. I also recommend to make yourself a spreadsheet with all the prescriptions you are taking if you are taking more than what you can remember, and to bring it with you both at your doctor's appointments and to a pharmacy if you have a new prescription. Okay, do you want to know how it ends? Was GD, the firefighter, able to survive the battle for his life? Let's see. GD took almost the whole antibiotic course before being admitted to the hospital, and while that may have contributed to his kidney damage, it also cleared out his prostatitis. But he stopped taking all his medications as per hospital rules and was only treated with the heart and kidney medications prescribed after being admitted in the hospital. Then he receives 3 hemodialysis sessions, and that's when his creatinine started to go down. In his unluckiest moment, GD was somehow lucky. GD was eventually able to spend the festivities with his family since the nurse let them visit him at the hospital. After 3 weeks in the hospital and 3 dialysis sessions, GD was finally able to get back home safely, even if he is now forbidden to eat tomatoes and bananas. Which is still a good news since more than 1,000 cases of triple whammy are documented every year and many of the patients don't make it. Guys, if you want to watch more real cases like this one, watch my video after. There are 7 reasons why many CKD patients find it impossible to reverse kidney disease. Today, I will share with you what they are and, most importantly, how to fix them. Yes, it is actually possible to fix many of the reasons why it is considered impossible to improve kidney health.
I think you're gonna like it.
I've actually met people able to reverse kidney disease and to keep their new improved levels for the years to come. But on the other hand, many patients are told they cannot improve by their doctors, and even worse, that trying to improve is futile. This is why I'm here today, to prove a point. My point is that if you have kidney disease, you can reverse it. But to do so, you have to make sure that none of these 7 points describes you. So what are the 7 reasons why some CKD patients find it impossible to improve their kidney health? Number 7, their diet is too complicated. Okay, this is a problem I see always more often. Patients, especially those with diabetes or allergies or other restrictions other than CKD, really don't know what to eat. You cannot have fruit because it has potassium, no dairy for the phosphorus, no meat obviously, and maybe you also have to avoid processed grains and packaged foods for the sodium. So there is nothing left to eat safely, and the patient is left wondering how not to starve. How to fix this? Well, keep following me here on Double O Kidney. The diet for those with kidney problems and diabetes is the main focus of this channel, and I'm doing my best to always find new things and new recipes that are 100% safe for those with kidney disease and diabetes. But there are other reasons that are preventing patients from improving. Number 6, some patients can't improve their kidney health because they don't get enough vitamins. This is a serious problem, more than people realize. In a recent study, 100% of kidney disease patients that ended up in the hospital for various reasons had 1 or more serious vitamin deficiencies. Which is scary if you ask me, especially because no one checked their vitamin levels before they ended up in the hospital. Make sure this doesn't describe you. How to fix this? A multivitamin can help, but it has to be made specifically for the needs of those with kidney problems. And I've talked about this in my video up here if you want to know more. However, multivitamins are made to prevent vitamin deficiencies, not to fix them. So get checked and ask for a test if you believe you have a deficiency, because even if doctors don't like prescribing tests for vitamin deficiencies, many kidney disease patients still need them. And what can be even worse than ending up in the hospital with a vitamin deficiency? Number 5, some patients cannot improve because they don't trust their doctors. Recent survey found out that 41% of patients in the US lost trust in their doctor in the last few years. That's a frightening number if you ask me, but I was not surprised when I found out about it. I talk with kidney disease patients every day, and it's clear that for many of them it's hard to trust or even to talk to a doctor. And unfortunately, this may already explain why many patients find it impossible to improve their numbers with kidney disease. How to fix this? This is not an easy fix, obviously, but it can be done, and it must be done. And while for some patients, spending more time at their doctor's office and asking more questions may be enough, others will have to find new doctors. But do all you can to solve this if you are in this situation. The reason is that many patients cannot improve their kidney health because, number 4, they don't comply. Compliance refers to the extent to which a patient correctly follows doctor's order. How many pills you take against how many pills you are prescribed. In the medical world, this is a much bigger issue than people realize, and it's taken very seriously. In the medical world, this is a much bigger issue than people realize, and it's taken very seriously. I mean, it's clear that if you get prescribed a medication that effectively slows down CKD, such as Farxiga for example, and you don't take it every day or you forget, your kidneys are not going to improve. What many people don't know is that a patient is considered good when they take even just 80% of their prescribed medicines. That's not a lot, isn't it? You basically could forget a lot of pills and still be considered good. However, studies found out that patients take way less than 80%, about half the time, which is not good at all, and also means that a lot of treatable diseases are going to be untreated. No way someone is going to be able to reverse kidney disease without adhering to the proper treatments. How to fix this? Make yourself a schedule. Set reminders on your phone, prepare yourself a pill box every week, and make sure you emptied the pills for the day every evening. Now, for many patients, lack of compliance doesn't happen because they forget. It happens because number 3, their doctor doesn't know enough about kidney health and the renal diet. Okay, I know that this will not help those that already have problems trusting their doctors, but we cannot overlook this issue. I talk many times about the low protein diet for kidney disease here on my channel Double Kidney and also on my page on Facebook. Frankly, the number of people in the comments that knows nothing about it surprises me. They just don't know that avoiding protein protects the kidneys and slows down CKD, and that you are supposed to follow a diet low on protein if you have CKD. And obviously, it's not the patient's fault. Their doctors should have informed them about this diet and other ways to slow down CKD at the first signs of decreased kidney function. But how often does that happen? Not very often, if you ask me. Many doctors still believe in the old mantra, wait till stage 5 and then start dialysis because there is nothing to do. So how can you trust your doctor if they clearly don't know what they are talking about? And this is not an easy fix either, as it will require you to go doctor shopping, and we all know how expensive that could be. Not to mention that a doctor that doesn't know enough also puts you at risk for number 2, taking dangerous prescriptions. Many people don't know this, unfortunately, but many prescription medicines put the kidneys in danger. NSAIDs are some of the worst, but they get regularly prescribed even in those with reduced kidney function. Proton pump inhibitors are dangerous too for the kidneys and should be always prescribed with caution. Same for antibiotics actually. Even worse. It's recent news that ARBs and ACE inhibitors, the most commonly prescribed medications for high blood pressure, cause kidney damage on the long term. Yes, as incredible as it may seem, the most used medicine to protect the kidneys are now found to be unsafe for the kidneys. This is a new study which is frankly scary, especially because doctors still have to prescribe ACE inhibitors and ARBs as there is no viable alternative today. Guys, by the way, never stop taking any medicine your doctor gave to you without their explicit approval, especially medicines for blood pressure. What's even worse is the danger of mixing certain medications. There are interactions that are very dangerous for the kidneys. And your doctor should know this very well. It's basically their job. But obviously mistakes happen and the patient is the one that's going to risk their kidneys. How to avoid this? Number 1, never stop getting informed. There are many dangers for someone with kidney disease, and being informed is the only way to avoid them. And I know that not everyone likes to think about the problem more than they need to, but not getting informed puts you at risk for all the 6 other points of today's video. So keep following me here on Double Kidney so I can share with you all you need to know about the diet, the natural treatments, and also the hidden dangers a kidney patient has to face. And by the way, I recently made a video about the most essential nutrients in a diet that fights kidney disease. It's up here if you have missed it. And this is all for today. Thank you for watching. God bless.